Welcome to the weekly blog sponsored by Spectrum Med. My name is Dr. David Hutchings. A couple announcements this morning. Again, we do have the NARA conference coming up, a two-part series on the impact of COVID on our patients with Alzheimer's and different forms of dementia. So we talked about that last week in our video. We'll cover, COVID fog, and we'll cover a lot of different areas there to cover that topic across the two-part series. And then also this coming Thursday at 1 o'clock with the Alzheimer's Association for Tennessee, we have a presentation on the impact that COVID has had on the caregivers of those who are caring for patients with Alzheimer's and dementia. So for more information on that one, we can definitely just go to the Alzheimer's Tennessee website, and it's going to be the Nashville, Tennessee chapter. So I do want to talk about a topic this morning. I don't have any notes or statistics on this, but I certainly see this in our patients very, very often. Nearly 100% of my patients, I see this, and I certainly, if you're interested in more of this, I can pull more data and have actual statistics for you. But basically, who was the person before they developed dementia? How has that impacted them? And how does the disease of Alzheimer's or different forms of dementia make that worse? So, for example, if we have a history of depression or anxiety, and typically, generalized anxiety and depression run coincide with each other. Typically, as we have and develop a form of dementia, Alzheimer's or whatever type of dementia that it is, those conditions, those pre-morbid psychosis are going to be worse. They're going to get worse. So we're going to have increased anxiety. We're going to have increased depression. I can think of a couple patients right now that I have that had bipolarism, depression, and anxiety. So we have a lot of psyche type diagnoses that have not been treated in many cases, and then we develop dementia, and it makes everything worse. So, for example, if we have a dementia that's very fluctuating, like maybe a Lewy body or a vascular dementia, one that's very fluctuating in its nature and how the illness progresses, those conditions are going to be much worse. So not only are you now treating the dementia itself and diagnosing and differential diagnosis of what type or types of dementia you're dealing with, but you're also having to treat the depression, the anxiety, maybe bipolarism, schizophrenia, or whatever type of pre-morbid psychosis these patients have. So it's really critical that we look at it in terms of we have a progressive neurological illness, but who was this person before, not only for their hobbies and who they were as a person, but who were they from a cognitive standpoint, and do they have any other pre-morbid conditions, because those will be exacerbated as we progress through that illness. So anyway, again, take that whole patient, look at who they were, because who they were then obviously is going to have an impact of who they are now as the disease progresses. So if you want some more information, just feel free to email me anytime. Keep the emails coming. Look forward to all the lectures coming up, and we'll see you guys next week. Thanks.